So this author, Becky Shannon's talking about the fact that she and her husband and all 5 of their children had pneumonia. It was one of the hardest seasons I've ever gone through. 2 of our daughters were hospitalized for the combination of a week. My husband and used up all of his vacation days, and I was so tired that my pneumonia returned even worse for a second time. All I wanted was to rest and see my family get better, so we didn't miss our summer. Something the Lord taught me through that experience was that looking at life through a lens of gratitude helps me rest in Him, refocus my life, and not get caught up in the discontentment of my everyday circumstances. It was so easy to wish things were different, more calm, less stressful, and less tiring. But God supplied what I needed through this time, and there were so many blessings to thank Him for along the way. The enemy wants us anxious and distracted and afraid of missing out. Sometimes we can become so consumed and discontented with life that we end up completely missing out on some of the most important things of all, our relationship with Christ. Practicing gratitude can remind us of how much we truly have, even when our physical measurements tell us we're lacking. As God's children through Jesus, we have an inheritance that is not from this world, and that's from Ephesians 1, verses 11 through 14. Spiritually, we are rich beyond what we can ever fathom and blessed beyond measure. God has set us up with every single thing we'll ever need to thrive, and that's from Philippians 4. All we have to do is ask Him, and we will receive. And then there are other references within Philippians that talk about this reading. But I think it points out so well that many times we're just looking for more or feeling that we're doing all we can and it isn't enough. So if we're currently feeling stuck in a busy season of anxiety and chaos, we need to know that there is a never-ending supply of what we need: peace, rest, contentment, joy, hope, and love. Life may not slow down or wait for us, but we are not alone. In the chaos, the stressful situations, and the demands of everyday life, Jesus is right there waiting in the midst, offering us a personal invitation to enter into rest and contentment at His feet. So she ends up with a bit of with a prayer, and I'm just going to add a few things to it. And she says, Heavenly Father, thank you so much for promising to give us everything we need. Thank you for supplying peace and rest when anxiety and fear tell us it's impossible. Thank you for contentment and joy when we start to worry that we might be missing out. Thank you for your hope and love when despair and bitterness try to creep in. During life's crisis and deepest hours, you are always there for us, God. You are so good to us all. And just in addition, please be with us this evening as we talk and explore illness that might have affected many around us, our family, our friends. Help us learn more about stroke, being aware of symptoms, and knowing what to do as family members, as care providers, and seeing those around us who may be having health issues. We ask you to be with us in your name. Amen. So I guess always in the month of November, we learn more and more about what there is to be thankful for. And we talk about it a lot, but sometimes we don't listen. So tonight, we're going to shift gears now. Now let's see if I can do this. While I'm holding on, I'm just going to bring up the first slide of the title slide here for Jodi and Jenn. So it's my great pleasure to introduce 2 of my colleagues, my former colleagues, and Jenn and Jodi have been experts on stroke and in many areas of neurology for quite a while. And I asked them just a couple of questions tonight. Jodi's been at Mayo 37 years, 27 in neurology. You all know Jodi Hellickson. I'm sorry, I better give you their last names. Jodi Hellickson, who is a member of Redeemer and actually on the health cabinet. But Jodi's been at Mayo 37 years, and 27 of that, as I said, in neurology, first as a nurse manager, and then moving into clinical nurse specialist. and 12 years as a CNS. The role of CNS, I always say the hallmark of CNS is a specialty in areas of care. And they're usually in the inpatient setting versus outpatient. But they work closely with staff, with patients, and families. Jodi has been at Mayo 27 years. I'm sorry, Jenn has been at Mayo 23 years, a few less than Jodi, and she has been 18 years as a CNS. She worked in other areas before neuro. She worked in ortho, and she has both of the ladies have been speakers at our national heart and stroke conferences, and really work closely, as I said, with staff to hopefully educate them in caring for stroke patients and their families. So they're going to job share tonight, and it's just my great pleasure to introduce the two of them. So Jodi and Jenn.
In tonight's talk, we're going to talk a little bit about what a stroke is. We're going to look at risk factors so you can kind of predict what your risk factors might be for having a stroke. And then we will talk about some ways to decrease your risk of stroke, and then what to do if you or someone you know is having a stroke. So, and then we have some little goodie bags to help you before you go home. So just to get started, so a stroke, really the easiest way of explaining it is when an artery carrying blood to the brain becomes either clogged or ruptured. And one of the things that you will hear a lot of us say when we're work with stroke is time is brain. So we always want people to get to the hospital as soon as they have these symptoms, because if we can decrease the amount of time that your blood vessels in the brain don't have blood supply, we can save some of that tissue. So sometimes if you've had a stroke, some of it can be reversed and some cannot. Just to kind of make you aware of how many people have strokes. So in the United States alone, we have about 800,000 strokes a year. So about 1 in every 6 people will have a stroke in their lifetime. So that kind of accounts, about somebody having a stroke every 40 seconds. So then as we talk about strokes, there's a couple different kinds. And so I think a lot of people get kind of confused out there because we use stroke for a lot of different things, and we use a lot of different lingo. Sometimes we'll say a bleed, sometimes we'll say a stroke. And so people are never really sure what we mean. So there are 2 types of stroke. So the ischemic stroke, which is a blockage, and then the hemorrhagic, which is caused by a bleed. So I think one of the easiest ways to kind of understand this is kind of to think of it as like a plumbing problem, right? So plumbers, either you have a clogged pipe or you have a pipe that ruptures or is leaking. So that's kind of how we discriminate between the 2 of them. So I think so I'm going to show you a little video. This is going to show you a video of an ischemic stroke. So it means that there's a clogged, and I'm going to play a little video and hopefully everyone can see on here. So when you're looking at this video, it's kind of showing you where that little clot is. And then all that area, I'm going to play it again here, that kind of white or gray area, that's all tissue that we're trying to save. So if we aren't able to remove that clot, that tissue in that gray area is going to die. And then that's when you get your disabilities, is when we can't bring that tissue back. And then when you look at a hemorrhagic stroke, that's more of the rupture or the leaking. And so what you're seeing here is you're seeing that rupture or leaking of the blood vessel. And then what happens there is you get, besides the blood that's forming outside of the artery, you're also getting swelling. And the thing is, when you're talking about your brain, we all have the skull, and the skull has no give to it. So if you start having swelling in your head, there's no place for it to go. And so that's when we start getting defects, or we're having disabilities or seeing issues within the brain. So I always try to tell people, so when we get bruises like on our arm, you see the swelling, it comes out, but there's some place for it to go. When you have swelling in your head, there's nowhere to go because it hits the bone, and then that can cause it to what we call herniate and start swelling and going downward. And that's when we start losing some of our brainstem functions. The other thing that you probably often hear a lot about is a TIA, and that stands for trans ischemic attack. And what that is like a mini stroke. So you get a temporary like blockage of blood flow in your brain, and you'll have symptoms that mimic a stroke, but they'll last only minutes or hours and they're reversible. But what happens is a lot of people kind of ignore some of those signs. And those are the things you don't want to ignore, because if you get those taken care of, you can actually prevent a full-blown stroke. And so you want to kind of be mindful of that and go and see somebody to see what they can do. So it's the same like symptoms. So if you have like a numbness or weakness in your face or arm or your leg, especially if it's only on one side of the body, that's not something you should just kind of blow off and say, oh, it's going to go away and ignore. You want to be seen. Or sometimes you have the sudden confusion or trouble speaking or understanding what other people are saying. That's another sign. Sometimes you can have vision changes, like seeing in one eye. All of a sudden you like aren't able to see out of the one side. Or sometimes it can be both eyes where you have blurry or double vision. If you notice yourself kind of stumbling or trouble walking and kind of dizzy, like you just feel like you don't have good balance, those are other signs. And then the other thing is a severe headache. And I think that is one that people don't always realize, because we all get headaches and think they're going to go away. But if you get this headache that's kind of persisting and you can't really identify a reason for having a headache, you want to get that checked out. Now we're going to talk a little bit about
Thank you. I know that row on the top, it shouldn't be there.
Is it?
Should be there.
Okay.
And then, well, Olivia, I guess that's okay. I was gonna hold the picture. You go ahead.
Move that. Okay. So we're first going to talk a little bit about risk factors. So we have the risk factors that you can't change and risk factors that you can have some influence on. So the first ones we'll talk about are you can't change. So none of us can change our age. There's no miracle pill out there for us to be younger or older, or whatever the case may be. So we can't change our age. There we go. There we go. Gender, we don't have any influence to what gender we were born with. Family history. One interesting fact about family history, that if you have a history of stroke in a first degree relative, you have a 50% chance of having a stroke yourself. So I think that's just kind of an interesting fact to keep in mind. And then we can't really change our personal history. So now if we look at the factors that we can have some control over, so hypertension is probably one of is actually the primary leading factor of a stroke. And so when we're talking about hypertension here, we're looking at if you have a blood pressure greater than 120 systolic blood pressure, you hear the doctor refer to that. So when you get a little high, like I don't think you don't have to get overly concerned. We used to say 140, now they're saying 120. But if you're over that 120, you want to just start thinking about the things that you can do to influence. So we could exercise a little bit, and even just walking. It doesn't have to be like huge, actually you don't have to go out and start running or, doing aerobics, but it's just even walking and increasing the amount that you walk will help. So think about that. Your eating, what you're eating, having that well-balanced diet, and then really looking at your salt intake. And a lot of it is just being kind of mindful of, a lot of things that we buy have a lot of hidden salt in it without thinking about. So if you're just thinking about a lot of your canned vegetables and stuff like that, or like deli meats and kind of processed meats like that, we don't realize how much sodium is put in that. So just kind of be mindful and just eat in moderation. The next one is high cholesterol. And so that's when your bad fats build up in your arteries And so we kind of refer to that as kind of the scum of the pipe. So when we think of it getting clogged in our plumbing here. And so that can lead to blockage over time. And so things to do to help that is a little bit more of the healthy eating, like we talked about, the exercise. And here again, when we're talking about exercise, it's not just aerobic exercise, but think about like strength training, just lifting some weights. And one of the new evidence base is doing the mind body exercises. So like Tai Chi or yoga or Pilates, those things give you some mild aerobic activity. And so really help decrease your cholesterol and your overall mental health as well. Diabetes. So if you have been diagnosed with diabetes, is really to watching your sugars, your diet intake, and then making sure you're taking your medications appropriately. And then again, a more of the exercise and eating healthy as well. Then we have heart disease. And when we're really looking at heart disease, you've probably all heard of atrial fibrillation. And that's when you have the condition where your heart beats irregularly. And this can cause the blood to sit in pool and form clots. And then what happens is those clots over time sometimes will migrate to the brain, and that's when they can cause strokes. So it's really important to manage that, manage atrial fib. So make sure you're seeing your doctor, using your medications, etc. Atrial fib increases your stroke risk five times that of a normal person. So something just to be mindful of. And here again, eating can help. So having a diet rich in fruits and vegetables and whole grains, trying to maintain a healthy weight. One of the other things people don't think about is you don't have to give up alcohol and caffeine, but you want to limit your amount of caffeine and alcohol use. Smoking, and you can be affected by secondhand smoke as well. And managing stress. Again, that's where that Tai Chi and kind of yoga, some of that comes in and can be helpful with that. There's a lot of that mindful breathing exercises too that we're hearing a lot about that will help as well. Obesity, smoking, we talked a little about that, and I shared how secondhand smoke can also contribute to that. So if you're a smoker, your stroke risk is 2 to 5 times higher than non-smokers, and you have to have quit for more than 10 years in order to decrease your risk. So just something to be mindful of as well. Drugs and alcohol, and we talked a little bit about that, about eliminating some of the alcohol. I think one of the big things we're seeing too now in this younger population is they're drinking a lot of those energy drinks, and they all have high amounts of caffeine in them. So people don't realize, but some of the young kids that I work with in their, low 20s, they're drinking 3 to 4 of those a day. And if you're thinking about 200 milligrams of caffeine in one, and they're drinking 4 of those a day, and then so they're increasing their risk of having like this atrial fib and those kind of issues. So just something also to be mindful of if you're drinking a lot of those. And it's all these new drinks are coming out. It seems like when you're watching the ads, or if you're in like Costco and Sam's, they have all these different varieties of flavored waters that are enhanced, and they all have a lot of this caffeine and very enticing flavors and name brands. So just something to be careful of, that if you're drinking many of them. A lot of people think they're drinking water, but they're not really realizing what else is in there. So you're getting the benefits of water, but there's a lot of hidden things in there to be mindful of as well. Sedentary lifestyle, we talked quite a bit about exercise. Sleep apnea. So if you've been diagnosed with obstructive sleep apnea, so you might have been prescribed a CPAP to wear to increase your clean oxygen overnight. So making sure that you're wearing that as prescribed. And then the unhealthy diet, we talked quite a bit about that. Any questions about the risk factors? Well, I think if you watch your caffeine, you have to watch the amount of caffeine. So if you're drinking all caffeinated, you might want to limit it, especially if you have a higher stroke risk than others. It'd be something to be very mindful of. I think people don't realize how much water one really needs to stay hydrated, and which also helps the kidneys as well. So I think what people the new kind of people always have said 8 glasses of water a day. And one kind of tip I always give people is, and I especially do this with my parents, trying to get them to drink more water, because as I see this every day, but if you use a cup or a water bottle that has a straw, you tend to drink more water. And I think it's just like a psychological thing, or it seems to go down easier. I don't know what the key is to that, but you drink a lot more. So they say to shoot for, if you take what you weigh in pounds and divide that in half, that's about how much water you should shoot for. Now, you don't want to go way overboard. So you don't want to say, oh, I like water, so I'm going to drink twice as much of that. You don't want to drink too much, but just to kind of give yourself, if you can shoot for that, either 8 glasses, around 64 ounces, or somewhere close to about half your weight in ounces. You guys have anything different to say about that? That's kind of what we've been. Mm-hmm. So we talked about how more than half of Americans don't even know they're at risk for stroke, and 80% of strokes can be prevented if you are watching the warning signs, or you can kind of know what your risk factors are. So in order to help you with this, we are going to give you a stroke risk assessment. So for the ones here in the room, we have little packets here, but it has this in here. So you can we'll give you a minute just to kind of take a look at it, and you can kind of score where you are, if you're at a higher risk or a lower risk. And for those of you online, we'll just give you a few minutes. You can see it on the screen, and you can kind of just make note of it in your head as we go on. And then I'm going to let Jenn take over from here.
I have a friend here at Victor that had a TIA, and her doctor said to take 2 baby aspirin a day.
Yep. So depending what type of stroke you have will depend what medications they give you. So if it's an ischemic, which most of the TIAs will be ischemic, then they would give you aspirin. If you're out in public and someone starts having a heart attack, everyone's like, oh, give them aspirin. For a stroke, we don't want you to, because if it's a bleed and you have taken a bunch of aspirin, then it's going to increase that bleed. So wait until we get our CT scan, and then they'll determine which type and what to be on.
Okay,
Yep.
Thank you.
And they'll do that for a lot of preventative things too. If someone's at high risk, they might look at their different factors and put them on some type of blood thinner too.
Does that help if you're on Eliquis?
Yes. Yep.
And amiodarone?
Yep. So Eliquis is another medication that we use sometimes too to help keep the blood a little thinner.
I've had 5 cardio versions,
Oh.
and they always say, take your Eliquis, which I do twice a day.
Yeah.
And
And
amiodarone.
Yep. And that's one of the big things, is to make sure that you're taking your medications as prescribed. Once in a while, we'll see people who the price went up, or they ran out and they didn't get in. And as soon as you stop it, your risk drastically increases in that interim period. So making sure that you're taking your medications appropriately. So hopefully you guys have been able to go through the risk assessment. This is just a really good tool to kind of give you an idea of the things you're low risk, the things that are higher risk, where either you don't know what your numbers are or you're higher risk, and to take this back to your primary care provider to really go through and kind of figure out what you can start working on to really decrease that risk. Like Jodi said, about 80% of strokes can be prevented if we implement measures early enough. So the goal is really to focus on those risk factors that are modifiable, that you can do something about to help prevent a future stroke. So regardless if someone has had a stroke already and we're trying to prevent another one, or trying to prevent a TIA or stroke from occurring in the first place. So really discussing with your provider your risk and options for lowering that. So Jodi spoke a little bit about some of these. So these are just some ways to decrease risk. We just talked about taking your medications as prescribed. And if you're needing assistance with cost or they switched brands or something and now it's making you feel sick or something, really talk to your provider about which meds you could switch to instead, because there's lots of options now. Eating a healthy diet. A lot of the fruits, vegetables, whole grains. If you've heard of the Mediterranean diet, that's like the #1 recommended for heart and stroke issues. Any type of exercise and active lifestyle. So again, it doesn't have to mean that you're going to go train for a marathon. It can just mean that you're walking to the mailbox a few more times a week than normal. Stopping smoking, drinking, drugs, vaping, all of those things are going to increase risk. Decreasing stress, and then really managing all of those other health conditions that you may have and making sure that you're on top of those as well. So a lot of times you'll do the quiz and you're like, wow, I've got like 3 or 4 risk factors. And there's no way for someone to be like, I'm going to work on everything at once, right? It's like setting your New Year's resolution really high and 3 weeks in being like, this is too much. And then you bail on your resolution, right? So you're going to pick 1 or 2 things to work on first. Don't try to change everything. Set really short, doable goals. So it might be a day-by-day goal. It might be a week-long goal, and then start adding from that. And then really celebrate your success. So it can take anywhere from 18 to 250 days for a person to form a new habit. So about an average of 66 days for that behavior to become automatic. So you're not going to work on everything at once. So maybe one of your risk factors was that you had high blood pressure. And so you might think about, I'm a super salty person, so I salt everything. So maybe I'm only going to salt my dinner meal and not my other ones. Maybe I'm more sedentary, and so I'm going to get up every few hours and do a lap around my living room. Or I have someone who gets my mail for me, and so I'm going to walk out twice a week and just really set those short goals to help try and make some progress. The other thing that's helpful is to have someone to be that you can report back to. So family member, friend, neighbor. Some people get like a little journal and they'll just start a chart, and every day they'll just write down the couple things they did. And then just remember, like, if you fall off the wagon one day, you're like, I didn't do any of the things that I was going to do, just start back the next day. All of us are working on different things. I know for me, like, I was always like, oh, I should start at the beginning of the year or the beginning of the month or the beginning of the week. So if I fell off somewhere during, I'm like, well, I'll just wait till next week. And sometimes next week never came, and I just, kept putting it off. So really celebrating all of those little successes that you do. So some of the signs of stroke that we talked about. So FAST is the acronym. So face, so looking at someone's face to see if their smile looks uneven, if there's some droopiness on one side. Having someone raise their arms, and if they can't move one, or if it's weaker, or if it kind of drifts down, that would be another sign. Any speech issues, so trouble getting your words out, trouble understanding words coming in. Do they sound kind of strange? Are they kind of slurring their words? And then time to call 911. So really making sure to call 911 and not driving your friend or family member in. So if you use 911, they give the emergency department a heads up. We can get everything set up and ready. And then as soon as you get there, we kind of hit the road and get you to CT and stuff right away. Some of the other signs and symptoms: numbness or weakness, vision issues, unusually severe headache, dizziness or loss of balance. So we'll kind of thinking of those. So inside your bag, you all have a magnet that has this on and a little wallet card. So just extra things that you can have around your house. One thing to know about stroke is it occurs suddenly. So this isn't something where, like, over the past 3 weeks, I've slowly gotten weaker. These are things that it's like all of a sudden, or you woke up and you're like, wow, I can't move my arm. Did I sleep weird, or is something going on? So it's sudden. They can occur at any time, day or night. You can wake up with symptoms. So maybe something, a TIA or stroke happened during the night and the person wakes up with the symptoms, and they may last a few minutes or they may be permanent. So really getting to the hospital quickly so that we can intervene.
I think I just want to share one thing. It's interesting. It's interesting to how many people we get on Sundays who've gone to church and then have had signs of stroke and end up coming in on Sunday. So I think it's just that I thought that just to kind of share that fun fact that they're around other people start noticing they might be on the other, but we have a large number of people that come in on Sundays with stroke symptoms.
Did you say, wanted to share that? Make a side comment. People might identify. Oh.
You're gonna all go to church on Saturday.
There are some additional symptoms of stroke, so that sudden severe headache. Guess I kind of went through these already. Loss of vision or vision issues, inability to understand speech. So you might be talking to someone and they're just not understanding, and you're asking the same question over and over again, and they aren't really giving you the right answer. Dizziness or loss of balance or coordination. Usually these are pretty severe. So it's not like mild dizziness where you're kind of wobbly. It's like I can barely walk and I'm holding on to things and the room is still spinning and kind of weird. And then swallowing problems as well. So an acute onset of swallowing issues, usually that's with facial droop as well, but sometimes alone. So kind of keep an eye for those things. Does anyone know what to do if someone's having a stroke? Fabulous. We're going to call 911. We're not going to give them aspirin or anything. We're not going to stick anything in their mouth. We're going to just kind of keep them safe until 911 gets there. So it's a medical emergency. Like Jodi mentioned, time is brain. So we want to try and do everything as quick as possible. That's why we would rather have someone come in and find out it's not a stroke than to sit at home being like, I'm not sure. I'm going to wait and see if it goes away in a few hours, because a lot of these interventions are very time sensitive. Please do not drive yourself or your family member in. So a couple of the treatments available. So the IV thrombolytic, we use tenecteplase or alteplase. So this is kind of like your Drano. You've got a clogged pipe and we're going to push some medication in and hope that it dissolves that clot. So there's a lot of qualifiers you have to have this, but you do have to be at the hospital quickly. So within 4.5 hours of the first time that the symptoms started. And then we can sometimes give that medication. That medication kind of goes in, it kind of dissolves that clot and restores the blood flow to that area. The next one would be clot retrieval. So this one we can do up to 24 hours after a stroke, but it has to be a stroke in one of the big vessels in your brain. So if it's in one of the tiny vessels, we can't get there. If it's in a big vessel, we can stick a catheter in and kind of suck that clot right out of there. And that can help restore and decrease the amount of disability after a stroke. If neither of those are options, or if it's a bleed, then we're going to do more close monitoring. We might do surgery to decrease brain pressure, medications to thin the blood if it was an ischemic one, and then a lot of therapy and rehab to get back as much function as possible. Life after stroke. So some people after their stroke, they go back to a fully normal life and their symptoms resolve. And they don't have any deficits after it. Some people have minimal deficits and some people have pretty severe challenges afterwards. So a lot of times it just takes some time to adjust and identify the barriers and challenges. So you might be ready to leave the hospital and then you get home and you're like, wow, I've got a lot of rugs that I'm kind of tripping over. I got to fix this. And you try and, I forget to turn the stove off. So I need to put a sticky note there to remind myself. So it's kind of some of those little barriers that you might find that then you're trying to help the person figure out different interventions to help keep them safe. There might be trouble getting around. So depending what weakness and stuff is left. So using ramps, drivers, accessible options for the home. Some people have memory problems, and these memory problems don't always show up right away in the hospital because you're kind of in a very controlled environment. We're doing kind of the exact same things. And then you might notice when they're getting home, like they might not be getting their mail because they kind of forget that even exists and stuff. So just kind of watching for some of those things to help put things in place for them. The other thing that we do during a hospitalization is we assess for depression. So if anyone had kind of tendencies for depression prior to their hospitalization, prior to their stroke, even if they've never had full-blown depression, that can come up a lot more after the stroke then. And then that usually leads to poorer outcomes if we don't put supports in place. So we do an assessment during the hospitalization to kind of see what the baseline is, and then we might recommend some more interventions prior to leaving. There is a service too through the Minnesota Brain Injury Association where they will do monthly phone calls to families or stroke patients. They'll help them up with different resources. So if the patient needs a ramp or something built at the house and they don't have someone to do that, they'll help find resources to do that. They can help with rides and a lot of support afterwards as well. really following healthcare provider recommendations. So continuing therapies, attending follow-up appointments, really working on those lifestyle modifications to prevent another stroke, and then trying to find a support network. So whether the person needs help with food or rides or setting things up at the home to be accessible, utilizing community resources to try and help support people and their families. So that's what we have for you. I want to tell you a little bit about what we have in the bag, which those of you on the phone will get that from Kathy. So you should have a little flyer that says recognizing and preventing strokes. If you scan this with a cell phone, it's like a 10-minute video on a lot of the stuff that Jodi and I talked about. So it's going to go through what is a stroke, risk factors, preventing stroke. So keep that one. The stroke risk assessment that we had up on the screen, that's in there. There should be a pamphlet called Stroke and Stroke Prevention. This goes through each of the risk factors and tells you what you can do to decrease your risk of stroke. This is kind of like our gold standard pamphlet that we use. Pretty fast, maybe. This is just like a little stroke card. Some people will use this as a bookmark, but it's kind of a big bookmark. And then there's some of them probably have a little pocket card in there. If you want to put something in your wallet or give to someone else, that's in there. And then there's two little journals. One of them, the white one, kind of has different writings in there where you can kind of track things. It gives you kind of areas where you can monitor your blood pressure, your food intake. So that's a good one. And then the blue one is Healthy Weight for Life. So it kind of gives tips on being active, healthy eating, and some of those as well. And then of course, our lovely little stroke bag has the FAST acronym on the back. Do you guys have any questions?
Well, I found it interesting that it talks about arms, because I was probably 3-4 feet away from a gentleman who had a stroke. And yeah, and it happened. He was sitting there in like corner, and what happened is he put his elbow on, and it fell off the table about 3-4 times, and a couple of us looked at each other, and then he started talking, but you couldn't understand. And the whole little story, you couldn't understand him at all. So someone else at the other end of the table called 911, and his carotid artery was plugged and he had surgery.
Yeah, and that's pretty common with the carotid arteries, the two ones in your neck, that those are kind of what cause a lot of strokes, and they kind of go in and clean them out and hopefully.
Primary doctor, like I have different arteries, and she feels my neck, you know, to see if my arteries, carotid arteries are okay. She can tell. Do you think she can really tell?
No.
No, it's probably feeling for a carotid
Pulses,
maybe,
yeah.
pulses or, like, see if you could-
And your
if you have
lymph
to get
nodes.
the pulse in there. You get a fault, you know, depending on how strong it is, but you really need to have like an ultrasound or whatever, or an angiogram to actually see how much is like clogged, or that scum like we were talking about in there, like build up, how much build up is in there, so.
Yeah.
I wanted to find out.
So if someone has high cholesterol, that's a lot of times what will trigger having a carotid ultrasound to look to see if it's built up in there.
I told you that my mother had a stroke, TIAs. So I was raised on a farm in northern Minnesota. We didn't go to the doctor very often. We didn't go to any doctor, dentist, whatever, very often. And she had several TIAs. And she would walk in the kitchen and hold on to one chair and go to the next, and my dad had already passed. And she didn't have she couldn't drive, that's for sure. But it also changed her disposition. She's cranky, like I'd talk about my dad and I'd say, you know, something good about him or something bad. There you go again. Talking about your dad.
Yeah, it all has to do about what area of the brain is affected, and so a lot of them happen in the frontal lobe, And so when you have blockage or bleeding in the frontal lobe, your personality is affected.
Mhm.
And so, we see that a lot. And I always like to share the story. My very first year of nursing, in the neuro ICU, I had a patient, I was working on an Easter, and it was a nice Easter week. The weather had been nice. And we were so busy, and usually on holidays, you always think you're gonna be a little bit slower, but we were so busy. And this little old man that came in, he's a farmer, he'd fallen off the tractor, he came in. And I was taking care of him, and his wife was standing in the hall up against the wall. I said, "Are you okay?" She's in there. Well, his bleed was in the front of his head, and he was using the F word like nothing. And she goes, "He doesn't even allow this word in the house." And here it is, but it can change. It just changes what you say, how you feel, gives you different affect. People who are depressed that becomes enhanced after that. So yeah, so you kind of do see that if they've had effects in the frontal lobe, and that's where a majority of them occur as well.
Yeah.
And sometimes it's more noticeable than others. My brother-in-law had a brain tumor in the frontal lobe, and we noticed personality changes, but people who didn't know them as well, his were subtle, so you wouldn't pick up on it, but for us that are around him a lot more, we notice those little things, so sometimes it's a lot more noticeable than others.
And sometimes the personality changes are hardest for the family members too, right? Like if someone has arm weakness, that's something you can deal with, but when the personality changes, that's really challenging.
Some years ago, one of our neighbors was down at the post office, and he was up at the clerk talking to the clerk, and all of a sudden he couldn't talk, he couldn't do anything, and he was just acting really strange, and she knew him well enough that she realized that he was having a stroke, and she called 911 right away. So.
I think it might be helpful, the two of you might just talk a little bit about rehab. I think some people think that, after a stroke or any illness, if they go to like a care facility for a few weeks for rehab, that's where they're gonna spend the rest of their life. Just the importance of that short-term care.
Yeah, so there's different rehab options, and so sometimes it depends on, so you can do, so if you have disabilities, so a lot of times it's, strokes will affect one side of your body, so you might be weak on your right or your left side, depending on what side of the brain, the stroke was on. And so it all kind of depends on how involved you can be in your therapy. So you can do inpatient rehab, which at Mayo Clinic, we have in the general building, we have an inpatient rehab center where a lot of people will go anywhere from like 2 to 4 weeks, sometimes a little bit longer depending, but for the most part. But in order to qualify for inpatient rehab, you have to be able to participate in 3 hours a day. So we always kind of tell patients, when we're getting ready about doing inpatient rehab, you have to think about it as a job. So you have to be able to get yourself up and eat breakfast in the morning, and then you're gonna have appointments all day long, because you're gonna see physical therapy, you see occupational therapy, sometimes speech therapy, and you're busy, so you have appointments, and you're coming back for lunch, then you might have a little rest time, and then you're gonna see therapy again, and then evenings are kind of your time, your family can visit or whatever. So that's one type of rehab. The other type of rehab is if you don't quite meet that criteria, you just don't have the stamina or the energy to participate in 3 hours, we'll try to find you like the skilled nursing facility. But that can be short-term or long-term depending on what your disabilities are. A lot of people will go there for 2 to 4 weeks as well, and they do get some rehab. In the skilled nursing facilities, it's not as intense as inpatient, but you can progress. So you could, like, if you can't initially participate and you need to go to a skilled nursing facility, if you improve and make improvements and can do that, then we can transition you to an inpatient or even outpatient therapy through the clinic as well.
Yeah.
Anything else you would add?
No, I mean, with a lot of stroke patients, it can take up to a year. So after about a year, that's kind of where we see where people kind of stay at their new baseline. But that whole first year is really when that brain is trying to recover and you're gonna gain different skills back as well.
Yeah, we usually say we will see the most improvement in the first 6 months. But we can see improvement up to a year. You can see it past that, but kind of where you are at that year mark is probably what your new baseline is gonna be.
Any other questions online? I think Jan.
Does anyone online have any questions?
One thing I should comment on, since we have a group, I'm assuming there, and I did have to leave for a little bit, but I want to point out your parish nurse can be very helpful after a stroke if you need one. She has available all kinds of equipment. She will visit, and if you need a ramp, we have people that will build ramps, and she would be available to help you, assist you in some of the cares after following a stroke.
Jan, it was hard to hear, so I'm gonna kind of share what you were saying. So Jan just said, as a parish nurse, they're a really good resource for people who have had strokes. So they can help you with equipment, because we have a list of equipment that they have access to here. They'll come and visit you, and so like if you have questions about medications or something, they can help clarify questions. And some people who might need a ramp, they have resources to people who are willing to come and make ramps. So to use those resources, which I think is a good point. We also have there's a number of associations, like there's a stroke association. Jen talked a little bit about the brain injury association, but a lot of them can help with equipment so if you can't afford things, or you're looking to get something for family members, don't be afraid to reach out to your parish nurse, because they do have access to those and they kind of know who to contact. And it's out there for people to use. And so I encourage you all to use that or share that with the friends.
Thank you. And I had to get my political ad in here. We don't have as many right now, right?
Thank
This
you.
has been wonderful. Thank you for the questions. And again, I was calling Jodi and Jen by their first name. You know, Jodi Hellickson and Jenn Wells Pittman. Again, they're both CNSs in the medical center here. And these are wonderful resources. The American Heart Association, American Stroke Association work in tandem. So American Heart has a lot, like Eleanor was saying, with AFib, they talk about stroke symptoms and treatment. So. Well, we thank you all very much. I wanted to mention we are not going to have a meeting in December because everybody's usually pretty busy during the holiday. Our next meeting then will be a Monday, January 13th. I believe it is the second Monday in January. And we have, we're kind of excited. We've been waiting. We've got a couple of speakers that are going to talk on mental health issues. And they're definitely going to do something in January. And February, and we might have NAMI, which is the National Mental Health Association, who have visited our church also present. So we've got some good topics coming up in the new year, and we thank you all for being with us. If there aren't any other questions, we usually end with the Lord's Prayer. So why don't we do that? Again, thank you all. Thanks those of you who were online, and we'll tune out. But we will see you all. Hopefully have blessed holidays, Thanksgiving, Christmas, and New Year's. And we'll see you in January.